Associate Professor Hannah Moore. I am the Program Head of Infections and Vaccines at the Kids Research Institute Australia, and I'm a research academic at Curtin University's School of Population Health. I started doing a Bachelor of Biomedical Science at Murdoch University in Western Australia, and then combined that with mathematics and statistics. And I really liked combining some medical knowledge with maths and understanding how to really analyse data. So after I did my undergraduate degree, I did an honours research year. I came to, it was then called the Telethon Kids Institute, and I met Professor Fiona Stanley, who was a guru of child health and epidemiology and research in Western Australia. And she really inspired me to understand more about research into child health. And I really found the field of epidemiology to combine all of the medical knowledge with understanding how to analyse data. I then went on to work at what was then the Telethon Kids Institute, now the Kids Research Institute Australia. And I went on and did a PhD, really had a real strong passion for infectious diseases research. And I was really driven by the data to see that so many kids are hospitalised for respiratory infections. It wasn't because they had accidents in the home, or it was really because of respiratory infections. So that really drove my passion to understand why. And so I went on to do a PhD, and then I've continued on in my postdoctoral research career. My area of research is really trying to understand the pattern of respiratory infections. I mean, in children, how many children are infected? Why are they infected? Is it everybody? What risk groups? And what can we do about it? So really trying to advocate for new prevention programs like immunisation, vaccine programs, and then also evaluating them, because it's all well and good to have an immunisation program, but until we see that the right children are getting immunised, and we really need to understand the impact of that program across the total population and across different risk groups. So my research program now really is about trying to understand the burden, the risk factors, and how best to prevent respiratory infections and other infectious diseases in children. I really like, as a researcher, having the freedom to be able to ask why. I can look at some data and sit there and really think, why are we seeing these patterns? Why is the rates of something like RSV so much higher in certain groups of the population than others? Why don't we have a universal immunisation program to combat this? So my passion really comes from being able to have that freedom to answer those why questions, and to work with such a brilliant group of people like consumer advocates, policymakers, clinicians in the hospital, and my other fellow researchers to really try to tackle those big problems. I have 3 young children at home. They keep me on my toes. I do like to spend a lot of time with them. I help around with all their different sporting activities. I'm a very passionate West Coast Eagles supporter, our football team here in Western Australia, the number 1 football team. I love doing that. I love camping and going on holidays with my family. And really just being out in the community and sort of spreading the word of what awesome science we have, and what awesome communities that we have, that we can really bring everything together to really make a positive difference in people's lives. I love it.